Today we're going to unpack one of the most brilliant and kind of sneaky marketing stories of all time. It's about a product you almost definitely have in your bathroom right now. But its journey to your shelf, well, it's an absolute masterclass in creating a need you never ever knew you had. So before it was all about fresh breath, Listerine was a lot of things. I mean, seriously, imagine mopping your floors with the same stuff you use for mouthwash. That's actually where our story begins, with this powerful chemical that could do pretty much anything, but it didn't have that one single compelling purpose. All right, so let's dive into the first part of the story. The company had this incredibly powerful antiseptic, right? But they were really struggling to find a big market for it. Basically, they had a cure, but they hadn't found the disease yet. I mean, just look at this list. It's wild. It was invented way back in the 1880s, and it was named after Dr. Joseph Lister, who was basically the father of antiseptic surgery. So Listerine was this true jack of all trades. It was in operating rooms, it was used for cleaning cuts, and yep, even for cleaning the house. A super powerful product for sure, but not exactly something the average person was going to use every single day. And that was the real issue. Sales were fine, but fine doesn't build an empire. The founder, Jordan Wheat Lambert, he knew his product had huge potential, but he just couldn't figure out how to make it essential to people. Listerine was the classic case of a solution that was desperately looking for a problem to solve. Okay, this is where the story gets really, really clever. Lambert's son had this totally revolutionary idea. What if instead of finding a problem, you just created one? Or maybe more accurately, what if you took a really minor issue and just rebranded it as something way more serious? And that was the big challenge, right? People have had bad breath since, well, forever, but it was just seen as a minor social thing, an inconvenience you just kind of deal with. So how on earth could Listerine turn that simple annoyance into a legitimate medical concern that needed a specific, powerful cure? And here it is, their stroke of absolute genius. They dug up this obscure, very technical-sounding term, halitosis. All they did was take the Latin word for breath, which is halitus, and then they slapped on that medical-sounding ending, osis, and just like that, bad breath wasn't just bad breath anymore. It was a diagnosable disease. This simple change in words was everything. Bad breath, it's temporary, maybe a little embarrassing, but halitosis? Whoa, that sounds chronic. It's unscientific, and honestly, it sounds deeply shameful. It completely shifted the conversation from something you might manage with a mint to a condition you had to cure with a real antiseptic. So now that they had a disease, the next step was to sell it. And Listerine did this by tapping into one of the most powerful human emotions there is, social anxiety. They basically figured out how to bottle the fear of being rejected and sell it back to us as the cure. Oof, I mean, that ad line is just devastatingly effective, isn't it? It creates this secret, this hidden shame, this idea that you could be offending everyone around you without even knowing it, and that the people who love you most are just too polite to say anything. That is a very powerful reason to buy a product that promises to solve that secret problem. But here's the other side of that genius move. While they created the anxiety, they also gave you a clear, respectable way out. You weren't just buying some cosmetic breath freshener anymore. No, you were purchasing a medical treatment for a diagnosed condition. It gave people permission to go get help for something that used to be way too embarrassing to even talk about. Now, this entire marketing strategy really hit its peak with a series of ads that became totally legendary. They would tell these little stories about relatable people whose lives were just being ruined by the secret affliction of halitosis. And the most famous one of all was the story of poor Edna. Wow. That headline just perfectly captures the quiet desperation and social fear the whole campaign was built on. They give you this tragic character, Edna, who seems to have it all, but she's being held back by this one fatal hidden flaw. And the terrifying thing was, everyone felt like they knew an Edna, or even worse, they feared that they were Edna. And the structure of these ads followed this brilliant four-step formula. First, you meet a character you can sympathize with, like poor Eleanor. Second, you find out about her secret, shameful problem, halitosis. Third, they really twist the knife by telling you that no one, not even her friends, will tell her the truth. And then, right at that moment when your own anxiety is at its peak, bam, in swoops the simple, effective, scientific solution, Listerine. So what's the lasting impact of all this? Well, Listerine didn't just become a household name. It literally created an entire category of marketing that is still incredibly powerful today. And to really nail their position in the market, they use these bold, scientific-sounding claims, 4 times better than toothpaste. See, that wasn't just a suggestion, it was presented like a clinical fact. It positioned Listerine not as a competitor to toothpaste, but as an essential, more powerful addition to your daily routine. This whole strategy now has a name. It's called medicalization, or sometimes disease branding. It's the process of taking a totally common human experience, like bad breath, or shyness, or even dandruff, and framing it as a medical condition that requires a specific product to treat it. And Listerine, they didn't just use the playbook, they wrote it. And that kind of leaves us with a final thought, right? This strategy, pioneered a century ago, is absolutely everywhere now. You see it all the time. So the next time you see an ad for a product that promises to cure a problem you never even knew you had, just think back to Listerine. It's a really powerful lens for looking at the world of modern marketing. You have to ask yourself, what everyday things are being turned into medical conditions right now?